welcome to another week of the Global Café. As you know, my name is Kara Cruz, and I'm a Senior Policy and Project Coordinator here, the IFA. So today we are speaking about one of my absolute favorite topics, the development of age-friendly communities. I know many of you are also invested in it. So Dr. Emer Coveney of Age Friendly Ireland has been kind enough to speak to us today. So Emer is the National Program Manager of Age Friendly Ireland, the local government shared service that manages Irish age-friendly programs and services. So Ireland is acknowledged by the World Health Organization as the first age-friendly country in the world by virtue of having all areas of local administration affiliated to the WHO Global Network for Age-Friendly Cities and Communities. And this is through the shared service structure. Emer manages a regional team who support the development of local age-friendly programs in every administrative area, and these multi-agency programs are coordinated by local government and involve partners in the statutory, private, voluntary, and academic sectors. So Emer manages the research unit for the shared service, which undertakes direct research relevant to demographic aging and engages with university research to provide an evidence base to inform national policy and support organizational objectives. Her areas of expertise include participatory research, social inclusion, community development, and local government administration. She has a PhD in gender and women's studies from Trinity College Dublin. And thank you so very much, Emer, for joining us today.
Thank you, Kira, for having me. Thank you. I'm looking forward to talking to you.
Oh, it'll be wonderful. So before we speak about the development of age-friendly communities, it'd be wonderful to learn more about you. How did you end up interested in the field of age-friendly, and what attracted you to the role of National Program Manager with Age Friendly Ireland?
So I suppose my own background, my primary degree was in communication studies. And when I completed that, I went to work, and my first role actually was in research. But I was working with an Irish Congress of Trade Union Centre in an area of socio-economic deprivation, so in inner city communities in Dublin. And I suppose I had a broad interest in equality issues from kind of that base. And I went on to do the Master's in Women's Studies, Master of Philosophy in Women's Studies, where my dissertation focused on women's lives in inner city Dublin and the kind of challenges they had and how they sort of supported each other and found their sense of agency. I worked in research in Trinity College in kind of social policy, looking at, again, a lot around equality issues, poverty, women's issues, drug use in kind of disadvantaged communities. And I worked with a local development company. And then the doctorate then was in gender and women's studies, and you said. So I suppose broadly my background was, very focused on equality, particularly, women's issues and looking at issues for marginalized and underrepresented groups. And then when I moved out of Dublin, then my first job was with Cavan County Council, which is a local authority in sort of north of the country, where I was doing research and community development and social inclusion work. And then as part of that brief, I became the local age-friendly program manager. So Cavan was one of the first counties to set up a local age-friendly program that was responding to a model that had been initiated in County Louth. And I did that for a number of years. Then when the national role became available, it was sort of an obvious move for me then to step up from the local into the national role. So that's kind of it in a nutshell, really, in terms of the trajectory for moving into the national age-friendly role.
Yeah, that's lovely to hear, kind of going from more, perhaps frontline isn't the word, but on the ground, getting to know individuals and the barriers that they experience and all the way up to where
Exactly.
you are.
And community development ethos is really, embedded in the program, that whole approach of, participation and involving the local communities and shaping the communities. That's really what attracts me to working in age friendly, because it's very grounded in community development principles.
Yeah, certainly. And as we can see from other examples within the global network of age-friendly cities and communities, that's really what leads to success. So could you share with us how Age Friendly Ireland came to be established and provide us a little bit more with the history?
Okay, so as you know, I suppose the WHO would have set out some of their initial documents calling on countries to respond to population aging. So from about 2007, I think they had their Age Friendly Cities Guide, and Ireland sort of responded fairly quickly to this. So at the time, there was an organisation that was focused on age friendly, and it was sort of an independent organisation, and it was funded by Atlantic Philanthropies. the first county, as I mentioned, was County Louth. So they really designed the model where it would be the local authority taking the lead, setting up a multi-agency structure to lead a strategic approach and having the voice of older people represented through sort of an older persons organisation as well. So that model was then kind of scaled up to all 31 areas of local administration, so all of our city and county councils. And it progressed and developed, but the philanthropic funding was running out, so there needed to be a decision about where it was going to be hosted for sustainability. And at that point, local government decided that they would take the lead on it, and a business case was developed to operate it as a shared service. So Age Friendly Ireland really came in, hosted by Meath County Council as a national office on behalf of the whole of the local government sector. So it's a shared service model. It's quite unique in terms of the different types of models for supporting age-friendly work in different countries. So we're quite proud of the structures and the model that we have here. It's embedded, it's funded by multiple government departments. So we really, emphasize that it's a whole of government approach, or, we're working with as many different policy areas and government departments as possible. It isn't just sort of, in Department of Health or one of the kind of traditionally people would think about health as the main policy area in relation to aging, but it's really across, housing, transport, Department of Taoiseach, arts, culture, all of those areas. And that's, it's working well now as that model.
Fantastic. So you mentioned in your response talking about the business case for Age Friendly. Could you speak to that a little bit further?
But the business case was really what, was looking at the model that, we wanted to operate. So it examined different possibilities. We could have it hosted by an independent agency, or have it within local government, or just rely on each local authority to run their own programme. But it was decided that the shared service structure would really give it the best possibility of having success in terms of a consistent approach and a consistent model. So the business case, we developed that on then. So when the shared service was set up, each local authority agreed to operate the model under an MOU agreement. So there's a memorandum of understanding that each local authority will provide the same type of age-friendly programme at local level with the same components, which would include the Older People's Council to represent the voice, the Age Friendly Alliance, and an assigned programme manager, and other elements as well. They would be kind of some of the key features in each local authority area, and that all was sort of set out in the business case, in the business model that was developed.
Thank you. Sorry, do you want to say anything further?
I was going to speak a little bit more just about the Older People's Councils, because really that's the most fundamental part of the model that we operate, is having the structure for the voice of older people across all of Ireland to be included and represented and reflected in the programme. And this is how older people are getting involved in shaping their communities. So the Older People's Councils are set up in each local authority area. We call them a two-tier structure because there's a very wide membership base. And then out of that, there's an elected executive committee who would be maybe the more active members who are sitting on committees and sitting on the Age Friendly Alliance, and maybe more actively taking part in the delivery of projects and initiatives. So the Older People's Councils are, they're designed to be very representative and very diverse. And they're there, they volunteer to give their time. So they'll come on to the Alliance, but they'll also come on to other local authority committees like strategic policy committees or local community development committees and that. So they can reflect older people's interests into a whole range of areas across the wider service areas of local government. And then we work with them at national level. We have a national network of older people's councils. I see our chairperson, Ita Healy, is here with us today. And they have an annual convention every year where there's an opportunity then to meet with political leaders, civil servants, people who are working on policy documents, a lot of consultation opportunities, and sharing of good practice and site visits that would take place at that convention as well.
Excellent, thank you. And like you said, I know that we have a few of the members of the Older Persons Councils on our call today. So welcoming any reflections in the chat, or if you have any questions, please do share with all of us, because it'd be wonderful to learn more about your experiences as well. So how you've kind of spoke about the idea that community development and the principles of being informed by older persons are ingrained within kind of Age Friendly Ireland's policies and within its ethos. How was it decided that older person councils would support Age Friendly Ireland, and how do you ensure that there's a diversity in terms of that representation?
Well, as I said, it was decided and agreed through the MOU with each local authority. So that's there kind of in the structure of the shared service, that there was sort of an agreement by each of the chief executives. And I suppose credit is due to the local authority chief executives who've taken a lot of the lead on this and kind of been the driving force behind it. They would chair the alliance structures at local level as well. In terms of diversity, the way the older people's councils are set up is that the elections are done on a municipal district level. So each administrative area is divided down into sub areas that would cover all of the geographic areas. So rural communities, urban communities, areas that are more affluent or, would have socioeconomic disadvantage in that. So on a sort of a geographic basis, there's nominations coming in there's also space on the committees for co-option of members. So the local program manager can decide if, they feel they're missing a voice of a particular segment of the older population that they can maybe target it through co-option of members. So for example, they might want a representative from somebody who's living in residential care, or an older person from the traveller community, which is our Indigenous ethnic minority community, or they might want somebody who there might be fewer men participating at local level, so they might go to the men's shed to see, can we have a co-opted member? So there's possibilities like that to sort of, ensure that diversity is reflected. And then in addition to that, I suppose we had a national campaign last year to try and increase diversity and sort of, grow the numbers that are participating in older people's council. So we had a lot of publicity, a national sort of radio and media campaign to sort of raise awareness of the profile of older people's councils and the work of the age-friendly programme. And then we worked with specific organisations, for example, LGBT Ireland, and they came and delivered training on LGBT awareness to our older people's council members, and there was very good interest in it. And we're having, some ongoing more targeted engagement. We're working with the small farmers and with St. Vincent de Paul as a charitable organisation as well. So we're always trying to increase the reach, and really that's a big part of the work of the local age-friendly programme manager is to sort of manage their older persons council and make sure that there's the throughput of members and throughput of voices. So the membership is designed as a 2-year term, and the chairperson will be there for a 2-year term with an option of returning for a second 2-year term. So that idea of keeping it quite dynamic so that there's people coming in with new views and new voices all the time and kind of feeding into the process. It's not just a typical community development group. It's really a consultative group and a representative group. So it's kind of constituted differently. And but the numbers are growing. Following the recruitment campaign, we had a 20% increase nationally in the numbers participating in older people's councils. So we hope to continue that as well, and continue the reach out into the community of them.
Yeah, that's fantastic. So just going to turn to a few audience questions because they're specifically on this topic. So first we have a question from Shmuel, and he's asking, what are your recommendations in effectively developing age-friendly communities amongst low or poor and low socioeconomic groups of the population? And I think perhaps this might align with Dominic's question, who's asking about anti-stigma programs, which I think you touched on a little bit. But Dominic and Shmuel, please add in the chat if there's anything else you're wanting to know.
Yeah. Okay, well, there's a lot of supports available. Again, your age-friendly program manager in each local authority would be sort of a senior middle management grade and administrative officer grade who would be quite experienced, would be coming in with usually quite a lot of community development, expertise. In terms of supports for maybe people who are from those harder to reach communities, they would provide training, one-to-one support. There's an induction. We have a program handbook. The regional managers provide training for older people's council executive members as well. So if newer members are coming on, they're given the whole sort of background to the program of what the role of the older people's council is, and then what their own roles on the committee are. The local program managers would provide training in sort of digital skills. They might provide tablets and different equipment as well if people are having difficulty getting to online meetings. We found that particularly with COVID, where we all had to do that massive changeover from face-to-face to online meetings, there was a big piece of the work was around supporting people which sort of affected by the digital divide to sort of continue to engage. So there was training and information guides and sort of a lot of help and assistance for that. In as well as that, like the program managers would organise sort of road shows and information events. So they're trying to encourage participation from all communities. So they would do sort of information roadshows, maybe that go around the county and, take place in different community halls and venues. And the public library network is very good as well. There'd be drop-in days and, information sessions and talks. So it's really trying to, try to just make sure that everyone in the community is aware, all old people are aware of the community and their opportunities to participate. And people can participate at different levels. So some people might just want to be on the mailing list and get the newsletter or be invited to the annual general meeting for the Older People's Councils. And then other people want to maybe over time become a little bit more active, get onto the executive committee, or maybe start taking part in some of the local projects or the walkability audits or, whatever creative projects or health and well-being, physical activity projects are on offer. So there's, I suppose, in terms of encouraging and supporting participation across all groups, like there's a lot of thought goes into it, and it's set out as well in the operating guidelines as well, so that new program managers who are taking on the program have kind of clear guidance on how they should reach out and include older people from all different types of communities.
Fantastic, thank you. And it seems like identifying the resources a community has already is a big part of that strategy as well. So I just wanted to know a little bit more about some key learnings that you've had as a result of engaging in co-design or involving older persons. Do you have any advice for those in attendance today who might be interested in engaging in a similar type of initiative?
Well, in my experience, I suppose there's always new information from a co-design process by working with older people. So if you take something like, the walkability audit process, if I walk down the street today and I'm a local government official and, I spot certain things and it looks fairly okay. But if you walk down the street with a group of older people or people with disabilities, they'll have new observations and fresh insights. And that's the kind of real rich data that we try to bring into the program, because you could be walking with someone to say, well, I need a rest stop here, I need to have a seat here, or I'm not clear about the wayfinding in this area because, I didn't notice the sign there, or I don't feel safe in this area because the public lighting isn't good or the hedge is overgrown or that. So it's just so valuable to have that level of information kind of feeding into the program. So that's particularly for the built environment projects, co-design is brilliant. But we've also worked with like maybe different organizations as opportunities for co-design for new products and services. So one of the ones that we had a lot of success with was the Acorn age-friendly digital tablet. And it was a private company that wanted to do a co-design process with our Older People's Council. So they were developing a tablet that would be more user-friendly for the older person, because a lot of there'd be some older people in Ireland who aren't comfortable with, digital devices and smart tablets and all that. So the idea of this entrepreneur was to create a tablet that was designed as an age-friendly product that would have, very easy to use interface, sort of bigger buttons, very kind of clear navigation and that. So there were groups of older people in 3 counties that actually worked on the development. They tested all the software, it was updated, they tested it again, they gave a lot of feedback, and the process was evaluated by Maynooth University. So that was a particularly successful model because that product is now on the market. It's also used in a lot of our public libraries where they will loan it out to older people who can kind of, try it before you buy it. They can take a loan of it from the library, and if they want to then go on and purchase a tablet for themselves, at least they've had a chance to sort of practice with it and experience it. So there's plenty more opportunities like that. Like we'd be contacted quite a lot by different academics and researchers and entrepreneurs who have ideas they sort of want to run past older people. So I think people do value that opportunity for co-design and kind of really hearing the direct voice of older people.
Oh, that's fantastic to see that older persons councils aren't just, or not just, but they aren't only an initiative intended to support the community council or the municipal council in being more age friendly. It's truly the whole community is involved or has the opportunity.
Yeah, it is. And we find, our OPCs would be hugely called on for consultation from many of the government departments for different pieces of research or, national policy that's in development. So whether it's around health and well-being. We did a good consultation there recently on the whole idea of the cashless society. So the Department of Finance is bringing in a policy around payments and access to cash. So we were kind of gradually finding there were shops putting up signs saying, digital only, card only payments, and you can't use cash, and everything from ticket kiosks to parking meters and everything are becoming cashless. So our department is is developing a policy around that. But older people certainly had a lot to say around that and around trying to protect their right to have a choice and, to have different options to pay and to reflect the fact that some people just maybe don't have bank cards or don't want to use a smartphone and that. So it's great. That's a particularly good example. So I think the policy, it's not published yet, but I think it is going to respond to a lot of the points that we raised in the submission.
Excellent. Thank you very much for sharing and seeing lots of activity in the chat. So you mentioned walkability audits. Barb Sheldrick is asking if you have any other survey tools that you could suggest to use for measuring age friendliness in a community.
Yeah,
you can always follow up afterwards as well.
we have, I know we've put our links in for our 2 websites, but all of our sort of resources, like we have guides to being age friendly in the public realm. We have, the Department of Housing has developed a tool called Assist, which is around selecting appropriate sites for age friendly housing. So it looks at kind of distance to pharmacy, distance to shops and services, and the location of the site and that. So there's kind of tools like that for measuring, where we should be putting in a new housing for older people. We also have sort of national indicators. We have under the Healthy and Positive Aging Research Initiative, we developed a set of national sort of positive aging indicators. So there were sort of survey tools and questions developed for those. And there's a big piece of work happening on sort of general wellbeing indicators for the population as well. There's a wellbeing hub under our Central Statistics Office. But some of our resources that are on our website will have our survey tools at the back. The main one we use for walkability audits now is the Universal Design Walkability Audit Tool, which we developed in partnership with the Department of Transport and the National Disability Authority. So it was really based on an older version that we have, but this was making it sort of multi-generational because it takes in the kind of walk around up to the school gate as well. So it's not just focusing on older people, but it's looking out for children who kind of need to walk safely through their communities as well.
Thanks so much. And Brendan Sherlock also highlighting that Age Friendly Ireland has a weekly newsletter if individuals want to be updated as well. So thank you for that, Brendan. Turning to one of my questions that kind of ties into the question in the chat as well. Age Friendly Ireland has many fantastic and innovative programs of work, including provision of guidance on universal design features to include in lifetime adaptable and age-friendly homes. Could you tell us a little bit more about the guidance?
Yeah. Again, some of our guidance is based on a consultation with older people. So I worked on a document called an Age Friendly Homes Rating Tool, which was put together with our older people's councils and was really picking out the key features they consider essential to having a home that supports you to age in place. We have a summary document called sort of the 10 ways, which is the 10 top features, universal design features that should be included. So we look at things like, first of all, the location of the home. Like it needs to be sort of well located so that people can access services easily, that it's on a public transport route, or that they can walk to the local shops and services. Older people tell us that they want to right size into 2-bedroom houses. They're not too keen on right sizing into a 1-bedroom home. And that's because they want space for their grandchildren to stay over. Or they want to have maybe a carer stay with them, or even space for a home office or study space in that. Like, so if they're considering moving from a 3 or 4-bedroom home, it's more attractive to them to move into a 2-bedroom home. In terms of technical specifications, we use a lot of the specifications developed by the Centre for Excellence in Universal Design, which is based with our National Disability Authority. So they have extensive guidelines called Building for Everyone for all aspects of the built environment, including housing. So if you're looking for the specifications for turning circles or corridor widths or doorway widths, or heights of, benches and that. So they will have all of that, and we incorporate that into our guidance. But our guidance also incorporates the actual voice of older people. So that information on, the extra space, the location of the house, wanting to have somewhere outdoor space where they can sit down in a garden area and that. And Another thing that has come through quite clearly in consultation with older people is the desire to have the intergenerational connections in the community. They don't want older people's housing to be sort of siloed off at the end of the town. They want it to be integrated where they can, go to the park and interact with different generations, or they can sit outside their house and see sort of the real life stuff going on all around them. So there's very much the approaches around trying to be integrated. So the technical program that we have a national technical manager, Declan Gaffney, and we have in each local authority, we have an assigned technical profession. So they would be architects, engineers, or planners, and they work together in a network with Declan. So at local level, they're promoting the development of age-friendly housing and age-friendly built environment projects. We have a lovely case study series now. So all the local authorities are really ramping up their delivery of housing that's going to be more suitable for older people. So we've age-friendly housing case studies with examples from each of the local administrative areas of new housing developments. So some of them would be maybe in old buildings. There's a lovely example in County Waterford where St. Joseph's was a convent building that's now been renovated into age-friendly units, and then some of them are new build housing as well for older people. So there's a lot of work happening in that space here at the moment. A lot of it was kind of driven by housing options for older people policy back in 2019 that really started to put the focus on why we need to prepare more housing choices for the aging population. So, and that's transferred on into kind of subsequent policies from the Department of Housing as well.
Great, thank you. And lovely to hear of the example of St. Joseph's. My gran lives just around the corner, so I'm well familiar.
Great.
But Roger has a question regarding universal design, and kind of a question on, is universal design a minimum standard? Like, is it a requirement within Ireland, or is this guidance? Could you speak to that further?
It's guidance. I suppose the requirement is the building regulations, and Part M would cover the accessibility standard in the building regulations. So from our perspective, in terms of age-friendly, that doesn't go far enough. Like it doesn't specify, for example, that you have to have a downstairs wet room. It talks about a visitable, sort of accessible toilet and that. So we would I suppose we promote sort of a higher standard, and we're hoping that the regulations will be revised so that universal design maybe becomes more the minimum level that people have to provide. So that is happening, but there are other things happening as well. So for example, the changing places toilet facilities, they've been going in around the country, and I'm sure you know what they are. They're the larger facilities for changing. So somebody needs maybe to have a shower during the day, they'll have shower facilities, the space for a carer to go in with them. There's usually like a hoist and an adjustable bench and that. So they would be coming in under the regulations now. But I suppose just to answer the questions, universal design, it's not mandated in the building regulations. A lot of the county development plans and city development plans are putting in their own kind of objectives for what they want to achieve in terms of universal design. So they might say, we'll commit to having 20% of age-friendly and universal design houses in our county development plan. And that's the framework then that allows development to take place in the county. So whether that's private development or social housing, and that a lot of the county development plans are using that process now to try and increase the availability of UD and age-friendly housing.
Excellent. Thank you so much. And thank you, Roger, for the question. I'd like to turn to a question from Emer on climate change. Emer, would you like to unmute to ask your question, or I can ask it?
Yes, just my question is, what's the strategy for the climate change and its effect on our age-friendly generation or category? We have economic effects, we have social isolation, which is a very big thing. We feel lonely when we are locked up at home. We have problem in health access. There's lots of issues with climate change. Is there a strategy going forward, considering that the climate is really rapidly changing and we can see that all around us?
Yeah, thanks, Emer, for the question. So it is something that we feel is really important, and we have assigned one of our regional managers to take a thematic lead on climate. her work to date has really been around engaging older people and providing training for them so that they themselves will become climate champions. There are local climate plans in every local authority area. The biggest piece we're doing at the moment is focusing on housing. So under the Healthy Age Friendly Homes programme, we're supporting older people to access grants and funding. So for energy retrofits, housing adaptations. We have coordinators now in every local authority area who will do that one-to-one support with the older person who's living at home so that they can kind of make their home fit for purpose. Amro, as you said, a lot of that would be, insulation, lighting jackets on water tanks, and maybe new windows and things like that would need to be covered. There's other opportunities then for, maybe extreme weather, if there's going to be extreme cold or floods, and that some of the local authorities and the libraries will have sort of, a room or sort of a cafe style room where older people can go during the day if the weather's very cold, if there's just some sort of community space in that. So again, I think Amro, I think we have been focusing mainly on housing, but there's definitely we'd welcome more ideas for what else we need to do in that area as well, in terms of, we want older people to really be very active in this area. And that was the idea of doing the training and the site visits. But we'll see where we can develop that further.
Wonderful. Thank you, Emer, and thank you, Emer, for the response. Staying in the chat, David Richardson has a question on consultation. David, would you like to unmute?
Yeah, sure. Just a simple question. It seems from what you're saying that Ireland does a fair amount of consultation on various issues of importance to older adults. And I'm curious to know sort of how that consultation is undertaken, by whom, at sort of what frequency, who's funding it, and so on. Because it seems, it's an important part of the development of age-friendly programs, but I think it's perhaps not done as much in Canada as it could be, to the consultation both at the local level and certainly at the federal level. Could you say a little bit more about how such consultations are organized and by whom and so on, and who's funding?
Okay, well, through Age Friendly Ireland, it's organised both at national level and local level. So each local age friendly programme manager would have a brief of doing consultation with their Older People's Council. They would do this when consulting to develop a new strategy. Some of them would do on-street surveys as part of the Age 2010 process. And they have the structure of the local Older People's Council there. So any local policies and plans that are being developed by local government can be run through the local Older People's Council for feedback. So that's the structure at local level. At national level, we support national consultation processes and also work with the university sector. So we would have a lot of researchers who are maybe doing research on aging, who want to hear from the voice of older people, and they will kind of contact us and ask us to help recruit for their studies and distribute their survey links and that. In terms of public sector, then, different organisations like the Policing Service and Garda Síochána, or the Health Service Executive, or the National Clinical Programme for Older People, would be in touch with us regularly, looking for specific focus groups or looking for response to particular documents. And that we have an ongoing piece of work with the National Clinical Programme for Older People, where they've set up a reference group drawn from our Older People's Councils for that kind of ongoing engagement. So at the moment, we've had a couple of sort of in-person meetings, but some of it is online. So they're going to circulate a document now. Look, they want particular feedback on the ambulance service, and they're going to circulate a document, and we'll organise an online focus group. So in terms of your question was who's funding it, like it's happening sort of, it's embedded in how we work. It's not kind of a particular grant coming in for a particular consultation. It's just under the brief of the local age friendly programme manager at local level. And then that would be my responsibility then at national level, through working with the Older People's Councils, to sort of manage those consultation processes.
Thanks, Emer, and thank you for sharing how it has been embedded part of the program. Peter also has a question about the functioning of Age Friendly Ireland, and I guess the scope of practice or scope of involvement. So Peter, would you like to unmute to ask your question?
Sure, off video, please. Good morning.
Yeah,
thank you. So I'm a geriatric neurologist, and there's a lot of controversy about Alzheimer's drugs. lot of push from the pharmaceutical industry to get them approved. So my question is, how does Age Friendly get involved in and influence policy discussions where there are competing priorities that might actually detract and take resources away from social programs and age-friendly communities and addressing the climate crisis, for example? Thank you.
So when there's competing voices, well, like as an organization, our only voice is the voice of older people's council. So that's the voice that we reflect. And then just we would try and have sort of balanced information going out. Can you maybe just say a little bit more about the example that you gave there, Peter? So
the monoclonal antibodies, 3 of them have been approved by the FDA, but the European Medicine Evaluation Agency just decided that their safety risks outweighed their minimal benefit. So that's what I mean by the controversy. And so people have to be informed in a democracy to kind of speak up against the powers that think the answers to age being friendly to older people is giving them drugs. Thank you.
We're not a lobbying organization at all. We don't advocate, so we wouldn't be advocating for bringing in, particular drugs or anything like that. Because we're hosted in local government, we use the co-design process as opposed to being an advocacy organization. So there's other organizations that would be NGOs here. There would be quite a healthy NGO sector working to support older people who might take more of a position on those sort of issues. But because we're a local government shared service, we would be mainly working with the statutory services. So if they ask us to consult with older people on a particular topic, we had a recent consultation for the health service executive because they're considering bringing in an enhanced flu vaccination program. So we facilitated that consultation with older people to give their views on whether they would be in favor of that, or what would they consider the risks or the benefits of it. But that's the type of feedback that we give to the HSE. We wouldn't sort of take a position on whether it's just reflecting, that older people would find that broadly positive that the HSE is considering a higher level of protection on the flu vaccination program.
Thanks very much, Emer, for just showing the various roles of individuals and actors within a democracy. So the role of civil society versus local government and being informed by older persons. So one of the aspects of the field of age-friendly that I enjoy the most is the openness and indeed perhaps requirement for collaboration. So Age-Friendly Ireland, like the IFA, is a member of the WHO Global Network for Age-Friendly Cities and Communities. How has international collaboration influenced Age-Friendly Ireland? And then in a perfect world, what would you want that collaboration to look like regarding the future of age-friendly environments?
Okay, well, there's just always new learning opportunities. I mean, if you look at the WHO resources, like there's good practice examples from all over the world. So, I mean, I'd look at it regularly if we're setting up a new initiative or a new project to kind of see, well, how do they do it in this country and what can we learn? Can we just repeat a model that's been proven to be successful? And that's one of our strategic objectives, is around scaling up good practice. It's not always about going out and developing something new. So you can use learnings from other countries. So in terms of the collaboration with the WHO global affiliates, there's just opportunities there for, the more developed programs to, give assistance and advice to the newer programs. There's opportunities for twinning. We have an agreement with New York, sort of a twinning agreement where we're going to sort of identify particular projects to work on together, sort of in a parallel process. So we've done quite a good piece of work here with some of the airports, trying to make them more age-friendly, and the whole, I suppose, possibility of increasing age-friendly tourism, inclusive tourism, and that might be something that we could link more in with New York on. So there's even, economic benefits that might accrue kind of down the line from those sort of initiatives. But yeah, it's mainly just, sharing the learning and the motivation as well, like being part of sort of a global movement. It's, because there's so many competing agendas, but when you're part of the WHO and the global network, like it's constantly high priority. It can't slip because you've got sort of a collective responsibility and a shared responsibility to the other members in the network as well. So I think that works very well. And then the second half of your question was on what I'd like to see in terms of
international collaboration in the future, or what would that look like in a perfect world?
suppose maybe more around the kind of measuring and monitoring, or maybe the KPIs are like, we're not sort of in a league table of which is better than the other in terms of the age-friendly work that we do, because people, countries and, you know, organizations will excel in different areas, but just sort of maybe a little bit more on the metrics to sort of, you know, and well-being, and that if there was some shared platform for knowing how well older people were doing, or the experience of positive aging, and that you know, we maybe be collecting the same data more consistently, so that could be something that could possibly be developed a bit more.
Yeah, of course. And I think WHO is trying to engage a little bit more in that work in the future to see what's the evidence base for the impacts of age-friendly, and how can we perhaps include those KPIs a little bit more. So that's exciting work to be following. So another type of collaboration is collaboration between generations. How does Age-Friendly Ireland support intergenerational activities?
A lot of that happens at local level through the local programs. So nearly all of them would have some sort of intergenerational component stitched into the local strategy. There's great examples here. We've had an award-winning sort of intergenerational choir in County Donegal called the Choir of Ages, where older and younger people, you know, have practiced and performed together for years, and they kept it going through COVID and everything. And then there's a lot of sort of, I suppose, smaller initiatives. So there'd be pen pal writing projects or befriending programs where young people visit older people in nursing homes, and reminiscence programs in the libraries and that. And we had a webinar actually on intergenerational practice recently, sort of from the national office, but a lot of it on the ground is happening through the libraries, through the local programs. We've invited older people or younger people to come to the National Convention of Older People's Council, so that they can give their views on, you know, what they want to see for the future in terms of a community that's age friendly when they get older as well. So in Ireland, we have structures called the Cuorlin and Oak, which are the junior councils. So they're nearly parallel structures to the Older People's Council. So again, there's quite a structured approach for accessing the voice of younger people, and they're hosted in local government as well. So they're there for consultation, and they would, you know, they would take part in different initiatives as well. So that's really how they work together. They would kind of tap into that junior council structure.
Great. And then I see Brendan is identifying that transition year students also can help with tech training and whatnot.
Yes, yeah, they're great at that, yeah.
Yes, thank you. And thank you as well, Mark Venning. I know you've put a few resources in the chat, including Danielle Aragoni's fantastic book, so I would definitely recommend that. Valerie Powell has a question regarding kind of, I guess, the role of advisory versus advocacy, or using those words within committees. Valerie, would you like to unmute and perhaps elaborate on your question?
Hi, sorry. We have called ourselves Age-Friendly Advisory Committee, and we have a good relationship with our municipal council and have advised, we thought, on issues around transit and community isolation. But in a recent meeting, they said that we really didn't have the power to advise our council, and they suggested we change our name to Advocacy Committee. And I just heard you say that you don't advocate, and I'm wondering if there's a better term, or how to just say you're age friendly. We thought it had a little more meaning to suggest why we're age friendly and what we do. So is there a better term being used?
Well, we use the phrase like that. It's the authentic voice of older people. Like they're not there as, I suppose, local government advisors, but it's representing the voice of older people in the communities. So I can understand kind of, yeah, the difference in how they might be interpreting it. That the views of your older people and your age-friendly council can kind of feed into the local processes and that, but maybe your municipal district doesn't see you as kind of the formal advisors. Like, they don't have to take the advice, but it can kind of feed into it. Yeah, that's interesting kind of around the name. Like, historically, we would have had different names on the older people's council structures here. So there would have been older people's kind of committees set up in different counties before the age-friendly shared service was established as a kind of a full structure. So they had different names, like we had Over 50s Network, or Later Life Network, or Older Persons Forum. older persons executive. So, we just decided then that the council was the best. And I think that, as I said, it sort of correlates with the youth council. So it gives it kind of that status of being a local authority committee, but it doesn't have the word advisory in it. All right. Yeah. So yeah, I'm not sure about that one, but yeah.
Okay, thank you. We're just about to embark on a walkability study. So this is where it came up in negotiations that they didn't want to be advised or have advocacy, but they wanted our input.
Yeah, maybe call it a co-design process then, and they might be, because it's helping to, your voice is helping to shape the process, but I suppose there's other partners like the technical people and the other officials and that will also have a view. So it's sort of everyone's view is of equal importance. But the older people's view then I suppose has to be more important in that process, of course.
Thank you very much.
Thank you.
Thank you both, and taking the opportunity to highlight some future work that the IFA will be doing, supporting another edition of the Age Friendly Environments ECHO programs. We'll be running that from October to December. So speaking on how older persons can be involved in age-friendly planning and whatnot. So if you visit the IFA's website, as well as our newsletter, which will be released later today, there's more information out there on that. So we're quickly approaching the end of this hour. But I know there have been a few questions on involving older persons who might live in retirement villages or long-term care facilities, etc. And you've mentioned this a little bit, Emer, but how do you ensure representation or access that representation from those who might not be living in their own homes?
I suppose it's a little bit more difficult. Like we did provide during COVID, we had funding from the health service and we provided tablets to the nursing homes because at that time, a lot of them just didn't have the equipment. So even for older people to phone their family members. But as I had mentioned earlier, like there was a big focus on delivering training and kind of one-to-one supports, and the libraries would do sort of training to help people to get online as well. And then we do allow, like if the older person who's in residential care, if their voice, wants to be, brought to the consultation and the discussion, it could possibly be represented by somebody like a nurse or a carer or somebody like there is space for them at the table in terms of participating in the older person's council as well. If somebody needs support or, buddying or mentoring to get involved, there are options like that can be facilitated.
Excellent, thank you. So last question before I introduce next week's topic, but where do you see the future of age-friendly going in a local and global context? What do you think cities and communities should be prioritizing as our global population ages?
Well, I suppose to date we have been prioritizing, transport, built environment and social participation opportunities, trying to increase, to address that issue of kind of loneliness and isolation by making sure there's a good range of events and activities on, and housing. I suppose we've had, a lot of issues here with housing, so it's really, been very important to try and make sure that the supply of housing is going to be there for older people. In terms of the priorities, like you can't select one priority for any particular area. What the priority is making sure that the structure is there to reflect the voice. So that urban communities and rural communities might have completely different priorities, but if you have the proper processes in place where older people in that community can feed in to shape their communities, then they will select the priorities that are going to be most important for them. In terms of our own kind of priorities in the shared service, we would like to do more work on age-friendly workplaces. We have a very good business program where we provide training to the business community, but actually look at the environment of the workplace and the policies and HR policies and how older people can be supported to stay and work for longer. It's a piece of work that we're hoping to commence shortly, and that would be something that maybe we could speak about maybe further down the line.
Thank you. And we actually have one more time for one last question, because I see Eileen has one that's quite relevant. Eileen, would you like to unmute, or I can ask your question?
Thank you very much, Sarah, and I wish you all the best in your future job and career. You, as you know, you mentioned your grandmother in Ireland and you were born here as well, so I wish you all the best. Emer, thank you very much for this great presentation. Can I ask you, have you done any summary research of what the consultation process has brought up on issues, you know, and annoyances, and that you're not being faced with the reaction of the process is ticking the boxes, and really what they're hearing is you're not going to influence the local authorities. Because we're doing a process of consultation at the moment, and it's, you know, the people who do turn up, they don't, you know, it's quite varied. Have you done any research on that, Emer? That would be helpful.
In terms of summaries of priorities, really what came out of the recent National Convention of Older People's Councils, we had an exercise of that, sort of a facilitated exercise for asking the delegates to document their priorities. And then we've done an exercise since then of looking at the issues that came through, looking at ones that we're currently trying to progress, or ones where we haven't given a response yet, but that there's still a priority that we need to work on. So we have a summary document available. We have a report available from the National Convention of Older People's Councils that will document the discussions and the priorities that kind of came up. And then we also have any of our written submissions that go into the government departments. You know, they will summarise the kind of findings from, you know, the consultations with older people. So yeah, there isn't maybe one overall document. I think the best one will be the report on the National Convention of Older People's Council. So I'll be circulating that shortly. It's with Kilkenny County Council at the moment, who hosted it this year.
Yeah, there is a view that it's like a postcode lottery at the moment. And we have a lot of very good things going on, and it'd be great if they'd be all over the place, but they're very spotted.
Yeah, that's part, as I said, part of our ethos is to try and scale up good practice. So like we work with the National Network of Programme Managers. So if there's good practice in one area, they share that information. And Eileen, like that again for the Convention of Older People's Councils, if there's any issues that you kind of want discussed, or maybe projects that you think should be showcased at the National Convention for scaling up, you know, we'd be very open to hearing that as well. But I agree with you, like there's so many good practice projects. Some of the issue is around sustaining them, you know, where maybe a grant has come in and there's a great piece of work done on, you know, a creative project and that. So can be difficult sometimes to sustain them, but certainly the ones that are proven and, you know, maybe evaluated and shown to be most effective and most successful, we should be trying to scale up and replicate in all areas.
Thank you very much.
Thank you.
Thank you both, and thank you, Eileen, for the kind words. And making note in the chat, there's a kind of side discussion going on about age-friendly and dementia-friendly. Too much to cover today, but perhaps that can be a topic for a future Global Cafe. And thank you, Cynthia Stewin, for recognizing that age-friendly is for a community for all, and that perhaps it should be a more synonymous term for a city that is somewhere that everyone wants to live regardless of their age.
Yeah.
So Emer, I'd love to hear your key takeaways from today's discussion, but to allow you some time to gather your thoughts, I'll first introduce our next week's topic and speaker. So please join our discussion next week, where we'll be joined by the IFA's newest United Nations representative, Dr. Alejandro Bonilla Garcia, and he'll be speaking about numbers, norms, and legislation, championing older persons in global pension policies. So really looking forward to that. But back to you, Emer. Could you share your key takeaway message for our audience today?
Key takeaway, I suppose, having an evidence base. So when, you know, there's so much happening in this field, but, you know, we have a partnership with one of the national universities now to try and, you know, expand the sort of data we're collecting and kind of measure and monitor things more effectively and more rigorously, I suppose. So, and then the evidence base for programming, and as I said, the voice of older people, like that's the key takeaway, that needs to be sort of nurtured and supported and facilitated. And the piece of work around making sure that the older persons councils are diverse is an ongoing piece of work. It isn't something you do today and kind of forget about it. So it's quite an important part of the program manager's workload, is to kind of keep an eye on that and to kind of continually reach out and make sure that it's fully reflective of different communities. So that's, I suppose, the main takeaway in terms of my view on running a successful age-friendly program, is to ensure that the participation is there from older people, and that they're supported to participate and give their voice and their views and their expertise into all elements of the program.
Yes, thank you. That really is kind of the key at the heart of all of this work. So thank you so much for sharing, Emer, and for being so generous with your time today. The work that Age Friendly Ireland is championing is really an inspiration to us all. So finally, before we sign off, I'd like to extend a huge thanks to our wonderful audience for their engagement today and every other week. It's been wonderful to get to know all of you, and you really are what fuels the IFA's work and make it somewhat easier to be online at 7 a.m. on a Friday morning here in Toronto. And as always, thank you to my wonderful colleagues at the IFA, in particular, Luana Colnego. She really is the leading force behind all of this. It would not happen without her. So thank you, everyone, and have a lovely weekend.
Thank you. Bye, everyone. Thanks so much. Bye-bye.